Our talk today will concentrate on what pharmacists need to know about a pod. So I have no financial conflicts of interest to disclose. And the objectives today, we're going to describe what a pod is, a point of dispensing, how it's used for distribution of medication during a public health emergency. We're going to describe the duties and responsibilities of a pharmacist in a pod. And importantly, we're going to understand the flow of patients through a pod. So the mission is to deliver critical medical assets to the site of a national emergency. This will be included in these assets are medicine and medical supplies to protect the American public during a public health emergency that is severe enough that the local supplies are depleted. And that's an important part of this, is that the first supplies and medication that you will use is what is on hand. I know at one time there were some surveys that went out that asked hospitals how much doxycycline and Cipro you had on hand. And it was encouraged at that point, I was actually working in a hospital at that time, and it was encouraged that we have enough to do a 10-day supply for all of our employees and their families in case of an anthrax event. And I tell you, for a small hospital, that was very difficult, because at that time Cipro was very expensive. Now it's the doxycycline that's outrageously expensive. So that was a level that we just could not achieve in the hospital I worked in. We felt like enough for the employees. So we've seen this picture before today, but what's in this supply is tons and tons of supplies. And it's called a 12-hour pushback. This term, I had difficulty, because my pharmacist mind, 12 hours meant more like a regimen than anything else. So I had to kind of switch gears when I was training for this. 12 hours means that the federal government can deploy it within 12 hours to the sites that need it. And in addition to what's already in stock, which you've heard about today, there is the vendor-managed inventory. So the federal government has agreements with manufacturers and distributors that will get us any kind of managed inventory we need within 24 to 36 hours. It is impossible to know what we're going to need because we don't know what event it will be. So this is a way to secure things that are outside of what we're sort of planning for, so that we can get these this inventory in. And also, if for some reason the SNS is used up or needs to go into too many different places, we can use the managed inventory to supplement that. But it would be tailored to that specific event. So what's in the stockpile? As we talked about, it's medical and surgical supplies. So that could be anything from IV start kits, bandages, dressings, IV tubes, all that sort of stuff, to pharmaceuticals. And that would include antibiotics, vaccines, antitoxins, and antivirals. Okay, so what will happen if the, what we used to call the SNS, now it's the MCM, is deployed? Once the federal government gets the call and makes the decision to deploy, it will arrive within 12 hours. The state health officer or his designee will sign for the material. Then the material will be shipped to the various receiving stages and storage area sites within the state. And it will be broken down and shipped to the hospitals, mass dispensing or pods as we know them, or the vaccination site according to need. And I know all you EP coordinators have put a ton of time into figuring out your population, how much you would actually need to service that population, how your pods would flow, how many patients you would need to go through per hour to service your whole population. So all of that is in the planning stage of getting ready for to determine what you would need and where the shipments and the quantities would need to go. So this is a picture of a pod. And we're going to go in a little bit more detail, but a couple of things I wanted to remind you about if you've heard it before, or tell you if you're new to this concept. The flow of the pod is extremely important. This is our entry. And so we've got, outside the entry, we've got systematic triage. Then we go in and you have your initial your intake or your initial triage. It's decided if through that which direction you need to go. So if it's you have your forms filled out that you know your what they call the NAV form, your patient history form. So they'll determine if you can go to express shipping, which is designated in the green, or there's a functional asset access need, whether that be hearing impairment, a physical, something physical that would prevent you from going through the pod, or if there's a special need, family, you're picking up for your entire family and there's a 1-year-old involved, so you need to go to family compounding, that sort of thing. And those patients that are really medically a challenge, like a dialysis patient or a kidney or liver failure patient, they would go, or even maybe a heart disease patient, they would go over to your DUR, to have more detailed pharmacy care. So as we work through the pod, you'll see the checkout, and we've got security and guides throughout the pod. It's important to maintain calmness, I guess is a good word. We can't deal with chaos through this. It's going to be chaotic enough. So if there's some patients who get a little bit rowdy, impatient, whatever, then would need security there for that purpose. And the guides are there just to make the flow easier. Around the room, you see the different signs. And when you're directing people to go, one of the challenges that we saw a few years ago was the signs weren't really clear. So we changed them to make them, so if you said go to the green section, all the green, as you see over here, with the express dispensing and the wait sign here, that's clearly green. But it also has it in Spanish and English, both the color and the site that it is. If someone's colorblind, at least they can read that. I mean, we tried to think of all different reasons people wouldn't see the signs. So making them predominant color, we thought would help the flow when you were directing patients through the pod. So why is the first triage outside the venue? We don't want to contaminate everyone within the pod when we have a symptomatic patient. Again, we don't know what the event what will trigger the event. So if it is someone that's coughing and is clearly sick, then we need to keep them outside the pod. So the stations in the pod. We talked about the symptomatic triage that's out in the parking lot. We've got the intake triage, express dispensing, really quick, pick up your medicines and go out. Drug utilization review, a little bit more complicated patient that it can't be easily determined what medicine you should be on if there's a choice. So this patient could be pregnant, like I said, it could have severe kidney disease, could be a cardiac patient that's on 20 different meds. So a decision could not be made quickly, so they go to DUR. Family compounding. Instructions would be given as to how to make a pill that maybe a 2-year-old can't swallow to liquid, and what dose would be appropriate for that younger patient. Special needs dispensing. There we would have translators. If you are in an area that has a large population of one language, you would want to make sure you have translators there that could help people who spoke only that language. Your clinical supply area is usually in the back, and there needs to be some kind of system where the pharmacist or whoever's in need of supplies can put up a sign, I need supplies, so a runner can bring them what they need. The other thing that would be there is first aid. You know, generally with that many people, something's going to happen. So your nurses would be manning a first aid station. And then checkout would be when you would gather all the forms that have to be returned to ADPH, make sure the patient understands their instructions, and get everything out, people out in an orderly fashion. So additional needs. We've got greeters trying to direct people where to go, how to fill out the forms. I know Julie has done a lot of work on the electronic form, and so that would be kind of ease the pressure there if people had the forms already completed when they came through. We talked about security and how important that is. Parking management. Somebody's going to have to be out in that parking lot making sure cars get in and out, especially if there's someone who has a physical disability that needs a closer or drop-off area. Somebody to do setup. It's going to happen really quickly, so you'd call in all the people on your list to the setup. Distribution and resupply the specialist. Again, there had to be a system where the pharmacist or whoever's dispensing would let the runners and people know that they need more supplies. Social workers, interpreters, and staff for demobilization. And don't forget this part. You know, it's kind of like the church picnic where everybody's gung-ho, they get there early to set up, but when it comes time to really clean up, there's nobody left. So just make sure you've got staff that's there to demobilize and they know what's involved in that. Okay, so what are the duties of a pharmacist? First of all, participate in the pod setup. One of the ways that I've learned the system was to go in and set it up, and it helped me put the pieces together. So I would encourage you to get your pharmacist involved in the setup. Attend the just-in-time training before going to a pod station. This is super important. For pharmacists who have not done this before, we hope they would go through a training that would show them how it works. But if that's not possible, the just-in-time training gives them an idea of what's going to happen. And we talk about counseling the patient. We're not talking about a 5-minute review of the medicine. We're talking about a 30-second, this is what you need to know. And that's, for a pharmacist, that's a different mindset. So we've got to get a certain number of patients through the pod in a certain period of time, especially if it was like an anthrax. They need to start treatment within 48 hours of the exposure. So we're pushing it. So the pharmacists need to have that mindset, and the just-in-time training will explain to them how to restock their station, what to say, what is the main points of counseling they have to get across, when it is appropriate to go to the drug utilization review or family compounding or other stations, not the express, but also what if it's that patient you just can't determine what medicines they will be on. There's forms for them to take to their local doctor. So all that stuff needs to be reviewed in the just-in-time training. The pharmacist will provide the clinical and dispensing expertise. So in a pod, when the dispensing law is waived by the governor, then that allows pharmacists, pharmacy technicians, and registered nurses to be dispensers. Now, the technicians must be supervised by a pharmacist. Other staff and volunteers cannot dispense medicines. So when you're placing people in a pod, keep that in mind. The law says that only pharmacists can dispense medicines. You have to have a license in Alabama to dispense. We don't have enough pharmacists to staff the pharmacies and the pods and in that short a period of time. So in an event, the governor will waive the dispensing law, which will allow the registered nurses and pharmacy technicians, if they're supervised by a pharmacist, to dispense in a pod and in a pod only. The pharmacist in charge, pharmacist there will work with the pharmacist in charge. And what the plan says is the first trained pharmacist that shows up at the site will become the pharmacist in charge until the designated pharmacist in charge can get there. Now, I've said that to several pharmacists, and they, oh no, I'm not going to be pharmacist in charge. But you, as the pod manager, are going to have to really work with them and explain it's not that difficult. You can do this. We need you, because someone does have to be the decision maker and the person in charge. The other thing is to know when you need to take a break and take one. Us pharmacists sometimes are on our feet for 14 hours a day. And we think that we can do anything. Well, we can't. You know, the mind is going to need a break. You just need a break to breathe. And so it is important that don't play hero trying to be there 24 hours. Take a break, get somebody else in so you can go off and get some sleep if the pod continues past that 16-hour period of time. And also to participate in the pod closing. Again, this is an important, demobilization is as important as setup, to make sure that everything is accounted for, all forms are where they need to be so they can come back to the state. We leave the venue in at least as good a shape as we found it, if not better. So it is from a dawn to dusk job for pharmacists. Okay, we're going to talk about the retail pharmacy dispensing, and it's set up very much kind of a combination of the Walgreens plan and what was used with Tamiflu back in, was that 09? I wasn't here then, but I was on the receiving end of that. And what we're also going to talk about the PrEP Act, which is very important to pharmacists and other health professionals. So why is it needed? It's going to decrease the number of patients in the open pods like we talked about. Patients who cannot travel or have limited travel or who really don't ever get out of their community can go to their retail pharmacist and get the medicine. And people in their community, especially small rural areas, they know their community pharmacist. So I think some people would feel much better about going there than to an open pod that's crowded with people. I don't know where to go. It's intimidating. I don't know what to do. So patients would feel much more comfortable in their community. So the pharmacy will receive the medications at no charge. And the way it worked in 09 was that we had a program within ADPH. They went online, they ordered a certain amount of Tamiflu, and they were given instructions on how to dispense that to the patients at no charge. Back then, they could charge a dispensing fee. If they get medicines from the MCM, they will not be able to charge a dispensing fee or an administration fee. So, and they will also have to complete the same forms that we do in an open pod. And they're required to return those ADPH, same process as the open pod. The system by which they order it, I can't demonstrate it for you. Our IT department says, yeah, we've got it, but until you can give us the specifics, we can't really finish it up. I mean, we got the skeleton of it, but, and obviously I don't know what medicine it is. They are prepared, though, to do that, to get it online very quickly. Medicines are intended for the employees of the pharmacy, family members, and patients of that pharmacy. So most pharmacies know how many patients they service in a month. So that's kind of what they would go by in ordering the quantities. They're to used only for the purpose dictated by the public health emergency. If they get doxycycline, they can't give it to someone who has a prescription for it for acne. So it can only be used for that public health emergency. And unlike in an open pod, a pharmacist must dispense the government-supplied medications. So, and again, if dispense is the legal term by the board, dispense. It doesn't mean to have to be at the cash register handing it to them. And they must sign an agreement before we would ship medicine to them. They are covered under the Public Readiness and Emergency Preparedness Act, which is called the PrEP Act. One of the main reasons that pharmacists tell me that they're shy about doing anything extra is because of their liability. So this act provides tort liability immunity except for willful misconduct to individuals and organizations involved in the distribution, administration, and use of MCM in a public health emergency. It does not cover unrelated activities. And I've given you the website where that PrEP Act can be found. This does decrease, this applies to everyone who is in a pod, a closed pod, and a retail pharmacy pod. So if you have any pharmacists who are concerned about their liability in this, give them that website to go look at how they're exempt from, or they're immune from liability when dispensing medicines. Okay, so to prepare for a retail pharmacy pod, your pharmacy management must agree to it, obviously, but they must communicate with their pharmacy employees. So there should be a dispensing plan. And I'm sure that all of you could assist in that. It doesn't have to be that elaborate, just how it would work. What roles and responsibilities there will be. They would need to give you a pod contact and backup contacts. They would know how to screen and complete the paperwork, especially the NAF form, and how to stay informed. You need to tell them how you're going to relay information to them. You know, radio TVs used to be what we would do. Now it may be somebody's Facebook page. So the management has also to communicate with the pharmacy employees because they need to know what's going on. I don't know if this is true everywhere, but sometimes when there's an event and the kids are home from school, there's no school, parents stay home too. And so that is going to be an issue everywhere if there is a true public health emergency that's widespread. So the pharmacy management really does need to explain to them why they need to come to work and that they will be the first to receive the medicines. It's just like in an open pod, it's important to treat the workers there and first. Well, in the pharmacy retail plan, that's true too. So the employees and their families will be the first to receive the medicines. They need to know when the medicines are coming, where they should store them, what duties they have, where forms are located, how to complete the forms, and also how to stay informed. So when you get the message and you know medicine, you've ordered the medicines, they're coming in, let your staff know. Very important. Assign your task. If you need forms in other languages, you need to let the state know that. And it's also important that these medications are stored in a secure location. They're separated from the other medicines in the pharmacy, and they're stored at proper temperatures. Very important that they're stored separately, because it is a separate inventory. As I said, medications are dispensed to the employees and their families first. Each person coming to a pharmacy pod would complete a form just like they would in an open pod. We do have in a pharmacy pod the head of household model. Obviously, this does not work if it's an injection. If it's an injection, then everybody has to come. Patients should bring a list of medications and known drug allergies for each household member they're picking medicines up for. Of all places, this is where it's probably most accessible if they don't have it. So the pharmacist would actually have a backup if they fail to bring it, unlike in an open pod. So the pharmacist would review the intake form for any contraindications and dispense the appropriate medication. They would provide that condensed counseling that we talked about, and the drug information sheet would be provided to the patient just like in the open pod. It has the toll-free number to call if you have questions or any adverse events. And they would have to, the pharmacy would return any intake forms, inventory forms, unopened medication bottle to ADPH. Patients should report adverse events to the phone number provided on the medication sheet. And it's important that if the patient cannot tolerate the medicine, the antibiotic provided, it's important they get another antibiotic. So that information certainly would need to be communicated to the patient. And certainly any serious reactions can be reported to the FDA. All of this is in your open pod tracking plan anyway, okay?